TPAPN offers peer support. Peer support is research-based and is widely used internationally. Peer support promotes sustained recovery from mental health and substance use conditions. When TPAPN first introduced peer support, we sought assistance and guidance from Substance Abuse and Mental Health Services Administration, SAMHSA. SAMHSA founded Brass Task, Bring Recovery Support to Scale Technical Assistance Center Strategy in 2011, a program promoting peer-run recovery. Brass Task was supported by the lived experience of people in recovery who played a significant role in program's leadership, development, and implementation, helping support peer-run recovery community in creating policies and practice guidelines. Cheryl Gagne, Senior Associate with the Center for Social Innovation with Brass Tasks, provided TPAPN with training and mentoring and developing a peer support hybrid. We also received a training from Via Hope. Via Hope is a nonprofit organization whose mission has changed how people view mental health and behavioral health since 2010. Peer support has a rich history going back to the 18th century when a hospital governor saw the value of hiring recovered individuals. He saw that they were gentle, honest, humane, and opposed to active cruelty. Peer support can count as a recovery activity, and it's important to note that the peer support relationship is confidential and is not shared with TPAPN case managers. Peer support mission statement. Our mission is to provide peer-to-peer support for individuals facing substance use and mental health challenges. Through the empathetic, nudge-judgmental, and collaborative relationship, we foster a safe, inclusive community where personal growth and recovery happen at a person's own pace, free from rigid expectation. We are committed to accessibility, acceptance, and the power of shared experiences to inspire hope and healing. What is peer support and its importance? According to SAMHSA, Substance Abuse and Mental Health Services Administration, peer support workers are individuals who have succeeded in their recovery process and help others experiencing similar situations. They let you know you're not alone. Through shared understanding, respect, and mutual empowerment, peer support helps people become and stay engaged in recovery process. Peer support can affect the reach of treatment beyond a clinical setting into everyday environment. Peer support is a mutual relationship that allows both partners to receive and give. In one-sided relationships, the role of the getter or receiver can erode their confidence, making them feel that they have nothing to offer. The idea of peer support is that individuals with similar experiences can better relate, thereby gaining more understanding, empathy, and validation. It's non-professional. TPAPN is a hybrid of peer support, nurses helping nurses. What does that mean? Because we accept all nurses volunteering, we cannot always pair a nurse participating in TPAPN with someone who shares their individual lived experiences. TPAPN provides training on addiction, mental health, person-centered care, and motivational interviewing, thus assisting the volunteer in developing the skills required to understand and have empathy for nurses with whom they are paired. Although TPAPN is a hybrid of peer support, TPAPN aligns with SAMHSA's definition of peer support, modeling a hybrid of their core competencies. TPAPN is a peer assistance program for nurses. The goal is to pair all participants with a peer support partner who can offer support, guidance, and hope. The peer support relationship can count towards recovery support activities and is confidential. Peer support training. Peer support partners will be required to attend an information session on TPAPN and peer support. Attend 4 educational modules and training on the role of a peer support partner. The modules include education on addiction and mental health condition, person-centered care, motivational interviewing, and CEUs are offered, followed by training on the role and expectation of a peer support partner. Upon completion of training, the peer support partner will receive a certificate. We encourage that those that complete TPAPN become peer support partners. So if you have any questions about peer support, you can contact Corrine Hernandez at chernandez@texasnurses.org or Stacy McCall at smccall@texasnurses.org. I conduct the training and education on peer support, and Ms. McCall assigns the peer support partners.